Welcome back to the channel. Today, we're diving into a wild encounter between a police officer and a woman at the mall that spirals into chaos. Did you know that approximately 1 in 3 police interactions involve individuals showing signs of substance abuse or mental health issues? Let's break this one down. It all starts when a police officer receives a call about a woman acting erratically in the mall. The mall staff reported that she had skipped the line at concessions. Situations like this can escalate quickly, especially if substance use is involved. According to the National Institute on Drug Abuse, around 50% of individuals with mental health disorders also face substance use disorders. This duality can complicate interactions with law enforcement, as we'll see today. As the officer approaches the woman, he notices she appears disoriented. Her demeanor suggests she might not be in a stable state. When he asks if she's had anything to drink, her evasive response indicates possible denial, a common behavior in individuals under the influence. Research shows that denial is a significant barrier to treatment for many struggling with substance use. According to the Substance Abuse and Mental Health Services Administration, SAMHSA, nearly 90% of people with alcohol dependence do not believe they need treatment. This denial can hinder necessary interventions. The officer informs her that she's being banned from the mall. As tensions rise, she insists on calling her husband, claiming he's an officer. This tactic is often used to buy time or de-escalate a situation, but it can lead to complications when not grounded in reality. Studies show that individuals who perceive law enforcement as hostile are less likely to cooperate, increasing the likelihood of confrontations. The Bureau of Justice Statistics indicates that lack of cooperation can lead to the use of force during an arrest, complicating the situation further. When the officer attempts to place her under arrest, she becomes combative, resisting and using aggressive tactics. Her claims of being a nurse seem to inflate her confidence, but she's clearly not in a rational state to engage with law enforcement. Resisting arrest can lead to serious charges. A study by the Police Executive Research Forum found that encounters where individuals resist can lead to injuries for both officers and suspects. Training in de-escalation techniques can mitigate these risks. As the situation escalates, she resorts to spitting and attempting to bite the officer. This behavior poses significant health risks and elevates the severity of the charges against her. According to the National Institute of Justice, assaults against police officers are on the rise, with over 60,000 reported incidents each year. The potential for injury during such confrontations is a serious concern for law enforcement. It's important to note the health implications of spitting and biting. Exposure to bodily fluids can lead to infectious disease transmission, creating further complications for officers and individuals alike. Research from the Centers for Disease Control and Prevention, CDC, highlights that certain infections can be transmitted through saliva, underscoring the importance of maintaining safe distances during confrontations. Ultimately, the officers managed to subdue her, but not without difficulty. She's charged with aggravated assault, disorderly conduct, and resisting arrest. These actions lead to serious legal consequences, but they also highlight the complexities of policing in situations involving potential substance abuse or mental health crises. The American Psychological Association stresses the need for mental health training in policing. Initiatives that provide officers with crisis intervention training can significantly reduce the likelihood of violent encounters, benefiting both law enforcement and community members. This incident raises broader questions about how society addresses mental health and substance use. Public perceptions often lead to stigmatization rather than understanding, which can exacerbate these issues. A survey by Mental Health America found that 56% of Americans believe that people with mental illness are dangerous, highlighting the stigma that can hinder effective treatment and support. Alcohol consumption can significantly impair judgment and coordination. The National Highway Traffic Safety Administration, NHTSA, reports that even small amounts of alcohol can affect a person's ability to make sound decisions. This impairment may explain the woman's erratic behavior in the mall and her difficulty in understanding the officer's commands. Understanding the effects of alcohol can help us empathize with individuals in similar situations. Many individuals in crisis are often met with law enforcement rather than mental health professionals. A report from the Treatment Advocacy Center reveals that individuals with severe mental illness are 16 times more likely to be killed by police than other civilians during an encounter. This statistic emphasizes the urgent need for better training and resources for law enforcement in handling mental health crises effectively. Resisting arrest can lead to serious legal repercussions, including additional charges and potential incarceration. According to the Bureau of Justice Statistics, about 30% of all arrests in the U.S. involve charges related to resisting arrest. This insight emphasizes the importance of understanding one's rights and the potential consequences of combative behavior during police encounters. De-escalation training is becoming increasingly vital in law enforcement. Research shows that officers trained in de-escalation techniques are more likely to resolve situations peacefully. A study by the Police Executive Research Forum found that departments implementing such training saw a reduction in use of force incidents. This suggests that better training could lead to improved outcomes for both officers and the public. Public perception of law enforcement plays a critical role in community interactions. A Gallup poll indicated that about 48% of Americans express trust in the police. However, this trust can diminish in communities where negative interactions are frequent. Building rapport through community engagement initiatives is essential for improving relationships and fostering mutual respect. Substance abuse is a complex issue that affects not only individuals but entire communities. The National Institute on Drug Abuse estimates that the economic cost of substance abuse in the U.S. exceeds $740 billion annually, factoring in lost productivity, healthcare expenses, and crime-related costs. Understanding these implications can help society address the root causes of substance use and promote effective prevention and treatment strategies. In situations like this, I believe it's crucial for law enforcement to approach individuals with compassion and understanding. Many people encounter police officers during some of the worst moments of their lives, whether due to substance abuse, mental health issues, or other crises. A compassionate approach can diffuse tension and lead to more positive outcomes. Officers trained in empathy and communication can not only help individuals feel heard but also foster trust within the community, which is vital for public safety. Substance abuse often carries a heavy stigma, which can prevent individuals from seeking help. Instead of being viewed as people needing assistance, they can be labeled as troublemakers or criminals. I feel that addressing this stigma is essential for creating a supportive environment where individuals feel comfortable reaching out for help. By promoting understanding and compassion, we can work toward destigmatizing substance abuse and encouraging recovery rather than punishment. The lack of accessible mental health resources is another significant concern. Many individuals in crisis do not receive the support they need until law enforcement is involved, which can lead to tragic outcomes. I believe we must advocate for increased funding for mental health services and community outreach programs. By investing in these resources, we can help prevent situations that escalate into confrontations with police, ultimately benefiting both individuals and law enforcement. While it's easy to place blame solely on law enforcement, it's essential to reflect on our roles as individuals and community members. We all have a responsibility to support one another, whether through education, advocacy, or simply being there for someone in need. I believe communities should work together to build stronger support systems that address the underlying issues contributing to these encounters. By fostering a culture of support, we can create safer environments where individuals feel valued and understood. Access to mental health resources is crucial. According to the National Alliance on Mental Illness, NAMI, nearly 1 in 5 adults in the U.S. experiences mental illness each year. Unfortunately, many people do not receive adequate care, often leading to encounters with law enforcement. Advocating for increased funding for mental health services can help bridge this gap, providing individuals with the support they need to manage their conditions and avoid potentially dangerous situations. We all share the responsibility to create a supportive environment. Engaging in community programs and advocacy efforts can significantly impact those struggling with addiction or mental health issues. Research shows that community support programs can reduce recidivism rates by up to 40%. By fostering a culture of understanding and assistance, we can build stronger communities that prioritize well-being over punishment. The woman in this scenario was charged with aggravated assault and disorderly conduct, which can carry serious penalties, including fines and jail time. Understanding these consequences is vital for individuals to recognize the potential outcomes of their actions. The way society views individuals in distress can significantly affect their interactions with law enforcement. A recent survey revealed that 62% of people believe mental health crises should be addressed by mental health professionals rather than police, emphasizing the need for better resources and training. The National Institute on Drug Abuse states that substance use disorders affect millions in the U.S., leading to significant social and economic consequences. Addressing these issues at the community level can lead to healthier outcomes for individuals and families alike. This encounter is a stark reminder of the challenges faced by both law enforcement and individuals experiencing crises. It raises critical questions about how we can improve interactions and address the root causes of such behavior. If you found this analysis insightful, please like, subscribe, and share your thoughts in the comments below. Let's continue the conversation on how we can improve interactions between law enforcement and the community.